Hi, and welcome to the Restorative Wellness Clinicians Corner, video series exclusively for functional health professionals, where we interview the top experts in the latest research, products, tools, and best practices for getting your clients exceptional results. Welcome, everybody, to the RWS Clinicians Corner. I am super excited for today's guest, Dr. Anna Cabeca. So, before I get into the formal professional bio, I have known, Hannah, how long have we known each other? Several years now through Mindshare and speaking gigs. And I remember seeing you speak at NTA a few years back. And I have just so much respect for Anna. She's just doing incredible work. Love her books. In fact, just this morning, I was talking with my clinical team, and we're recommending as step one in the strategy for a client that they get the Keto Green book and follow that dietary protocol as their step one. So totally love her work. And I'm really excited to dive into the topic of female sexual health, which is something that we all kind of bump up against. But quite honestly, I don't think very many of us are actually really equipped and know how to handle it, like what's in our scope, what's out. So we're going to dive into all that juicy stuff. Let me read her very impressive bio. Anna Cabeca is the best-selling author of The Hormone Fix and Keto Green 16 and the recently out, which I've got. Oh, not right there. It was right there before. I was just reminding myself about how much I love it. And menopause, which we're also going to talk about today. She is triple board certified and a fellow of gynecology and obstetrics, integrative medicine, and anti-aging and regenerative medicine. She holds special certifications in functional medicine, sexual health, and bioidentical hormone replacement therapy. She lectures frequently on these topics throughout the world to large audiences and is known nationally as the Girlfriend Doctor and is host of the Girlfriend Doctor Show. She has personally developed natural products to help women balance hormones and thrive through menopause, including the highly acclaimed Julva cream for the vulva, which is amazing, and Mighty Maca Plus. And it's not listed here, but also Keto Green, Keto Green, the smoothie powders, which I love. And I always take them with me as my, what I travel with. And she lives in Dallas with her daughters, horses, and dogs. So welcome. So excited to have you here.
I love everything you're doing, and it's really an honor to be here with all of you.
Oh, well, we're so excited. Now, I would love to can you tell us your story? Like, what got you interested in women's health, women's sexual health in particular?
Oh my gosh, you guys ever hear the expression, your mess becomes your message? That's so true for me. That's absolutely so true for me as well. And I think it was my own mess that got me into it, really. I love women's health because, as a young girl, I saw my mom go to doctor. And I recognized very early that most of the research they were basing her care on was done on men. And so I wanted to go into research for women. I wanted to understand what's happening with polypharma. How can I best serve so that we can have optimal health and not, go down the route where my mom did, which, at age 67, she died undergoing a second heart surgery on 11 prescription medications, no two of which were ever studied together in a person, let alone a menopausal or postmenopausal woman. And her life ended tragically way too soon. She didn't get to see her grandbabies grow up. And when it comes to sexual health and, understanding her hormones were never addressed, the concept that I delved into through my own personal story was how important the hormone oxytocin is. So you guys know what oxytocin is, this hormone, the most powerful hormone of our body. It's a longevity hormone. And recognizing that in times of stress, trauma, through physical ailments, and just having your own journeys, your own story, but certainly having adverse childhood experiences, post-traumatic stress, chronic daily, everyday stress, how that cortisol, oxytocin can play against each other and leave you into this physiologic state of disconnect where relationships go awry, maybe get broken, where your physical health starts to go downward, hitting a bottom. It did for me with early menopause at 39. So how stress affected my hormones, and then going through my own journey, reversing that early menopause, regaining my health, and being empowered really in my own journey to focus on how important oxytocin is and sexual health is for optimal health. So it's been a long journey, and I'm glad to be here to share it with you and share some of the things that I learned that helped me, but also helped, now hundreds of thousands of women through my programs and products and solutions and education.
Well, there's so many things I want to dive into there. And I actually didn't realize about your mom. So we are kindred spirits there as well. That was one of the major inspirations for me, as you know, about with my personal health journey, losing my mom too early, to ultimately side effects as well from the medications that she was on that were keeping her alive. So yeah, that's a very powerful motivator to make sure, sort of not on my watch, right? I know that's kind of my mission. It's like, not on my watch. Right. You talked about the way you're talking about sexual health already. I'm hearing a difference, because this isn't just about like the bedroom, right? I mean, that's an important piece of it, but that's not just what we're talking about. I mean, it's so important to overall health and vibrancy. It doesn't, it's not about whether you're in a couple or not in a couple. So can you talk to us a little bit more about like the role of sexual health and just female overall health and wellness?
Yeah, absolutely. And I think it comes to the fact that, like, as far as sexual health is concerned, like where we as women gain so much pleasure, it's from orgasm. It's, intimacy. But how many clients have I worked with that never had an orgasm, or that rarely have orgasms, or recognize the importance of the oxytocin in intimacy? It's for us, right? It's for our health. It's our benefit. And there are many things that can interfere with that. And so addressing those underlying issues really makes everything else better. It really does make everything else better. It's the fastest way we can get to optimal health.
That's wonderful. So let's dive a little bit more into the oxytocin piece. We talk about it in the RWS curriculum. We talk about it, when we're talking about the adrenals in particular, the relationship with cortisol, that's sort of where we explore it. But I feel like we sort of just mention it and then kind of move on. Like, can you give us sort of like the deep dive into why oxytocin is such a needle mover for our health and hormones overall?
Yeah, definitely. And one of the things, Margaret, is that the importance, like for me, I didn't understand that, right? And I'm trained OBGYN. I trained in, I really dug deep into hormones. And the only thing we knew about oxytocin is that inject Pitocin during labor, right, and that will help, but through my own journey. And I'll share with you, because of my own personal trauma, losing my mom way too early, losing my son in a tragic accident that left me traumatized and grief-stricken for many years, and how that affected my physiology with that cortisol oxytocin disconnect. Realizing from there, I burn out from my business that I loved. I love my practice in gynecology and working with women, and it burnt me out from my marriage that we were committed to staying together. And I looked and said, why? Why did we fall apart? What was the underlying physiology to the divorce? What was the underlying physiology to the burnout? And that's where I dug deep into oxytocin and really understanding how important that is, gaining pleasure in our life, even when we feel like we don't deserve it. Right? When we feel like, we can never be happy or have joy again in our lives. And I certainly had felt all of that. And recognizing that as, I dug deep into oxytocin physiology and also post-traumatic stress and what that does to your body, really understanding that in order for us to have optimal health, we have to empower the most powerful hormone in our body, and that is oxytocin. And not many people talk about it. And then what's one of the most powerful ways we can do that? There are many. We're going to think positive. Right. We're going to have fun. We're going to laugh. We're going to play, but we can also experience intimacy, connection, and orgasm. And when I recognize that this powerful piece was left out of our medical curriculums or was not discussed during our medical evaluations and examinations, that I was doing a disservice to my patients. And I certainly was doing a disservice to myself, because as I prioritized oxytocin through, many of the ways in managing cortisol and optimizing, increasing our body's natural production of oxytocin, that addressing the important piece of sexual health, what's keeping us from experiencing sexual pleasure, and what are the differences between men and women when it comes to the, that experiencing pleasure, having orgasm, having an elevation in oxytocin through intimacy, addressing the things that were keeping us from doing that. And as a gynecologist, it came a lot of times down to vaginal health. I would say that vaginal health is critical to optimal health. Mm-hmm. And so we tie that in: sexual health, orgasms, vaginal health. Mm-hmm. Those three components are critically left out of our discussions. I'm glad we're talking about this here.
No, I'm so glad we're talking about this too, because I think about, we're so hyper-focused on the negative side of the equation. We're so hyper-focused on the stress piece, the cortisol piece. I don't think there's anybody who is not aware. Even like the lay person on the street sort of in their head goes, cortisol bad. Like if they've heard anything about hormones, they've heard that piece. And as practitioners, we spend so much time thinking about the negative impacts of stress, but really shifting that lens as opposed to mitigating stress, minimizing stress, offsetting stress, doing things to increase our resilience to stress, focusing on the positive, on what we do want to create, and really thinking about the other side of, this sort of this balance, like really putting our attention to the pleasure side of the scale. It's actually, as you're talking, almost alarming how much that's not a part of the conversation. It just doesn't enter the conversation. Yeah. We're so hyper-focused on the other piece. And that just makes so much sense when we know these two things. And we do things, as you say, to increase that. I think we're aware of that, but making that, I think it's interesting talking about vaginal health, talking about orgasm. I wonder how much of this is also, as women, so often we put ourselves in terms of our needs at the bottom of the list, right? There's the family, there's the business, there's the household, there's there's everything, right? And then we come to the bottom of the list. And I'm wondering how much that just plays into the overall focus, because we're so focused on all the things that drive stress. We're not even thinking about the things that can really dramatically offset that in a way that's much more proactive.
Right. And if we look at it that way, we're focusing on the negative, right? Cortisol, there's good to cortisol. It's a life-saving hormone. But when it is ruling the roost, there's chaos. There's chaos with all our reproductive hormones. And the last thing we want to check off on our to-do list as women is most likely have sex with our partner, right? To have some pleasure, do something fun. That's like the last thing on the list. And especially when it comes to sexual intimacy. And if we're having negative feedback from that, we're feeling like less than, I'm not having orgasms, or, I just need to do this for my partner. And we're not recognizing, no, that's for you. It's for you to have the most healing hormone in your body optimized. So I think that was game changing for me in my approach to medicine, approach to women's health, and certainly in my approach to my own healing journey, right, to encourage daily oxytocin hits, right? So whether it's from self-pleasure, you can do this with or without a partner, but self-pleasure, certainly, and prioritizing all the other ways that we can optimize oxytocin and make sure that we are healthy. And when our vagina's not healthy, the body's not healthy.
Totally. I want to dig into the physiology in a second here, but just before we do that, because we know that one of the things that is combating is hard for us to orgasm, to get in that mood, is the stress.
Yeah.
Right. So how do you coach your clients to make that transition if they're feeling like, I mean, I know that feeling so well, like the weight of the world is on me and, I crawl into bed just exhausted at the end of the night. And my husband's like, hey. And I'm just like, oh my God, you have to be kidding me. Like, there's just no way, and even if he's all like, let me take care of you, like he's so loving about it. It's not just him getting his needs met. He's so overt about the fact that it's for me. It's very hard to switch off the stress side of things and flip into a place where it's even a possibility. So how do you coach? And I know so many women are in this situation. How do you coach women through that?
Yeah. And I think it's important to realize that, especially after the first 2 years of marriage and in menopause or beyond, when our desire is secondary, it becomes this natural secondary desire. So as I started having conversations with my patients about this and other women, and they would say to me, Dr. Anna, I never want to initiate sex, but I'm okay once we get started, once the play starts, then our physiology kicks in. So
right.
Dopamine, oxytocin, testosterone, we're going to increase that natural secondary desire and be able to more go with the flow. So that's one, is to recognize you're not broken if you're not having initial primary desire, but if you are receptive, now how do you get receptive? That's another issue. There's a hormonal component, but and then how do you recognize that you're there to enjoy and receive that pleasure? Because exactly what you're saying, I would say this is the number one secret that all women need to know about men, is the fact that they want your pleasure. They want her pleasure. That's what they're not there just to have an ejaculation. And believe me, I asked the most chauvinistic men that for sure I knew they were going to have like a chauvinistic answer. Like, what do they get from sex? They get off, right? But what are they really getting off of? They're getting off on their pleasure. So this is the secret. I asked so many men this question: what's the number one turn on for you from being with your partner? What's your number one turn on? And hands down, 100% of the time, can you guys put in the chat what you think the answer would be? Oh my gosh, I totally want to hear it. What is the number one turn on for guys? What do you think that is? So, let's see here. Molly says satisfying their partner. And Amanda says my pleasure. So absolutely, your turn on is his turn on. Your turn on is their turn. The fact that you are receiving, are having pleasure, are able to communicate that pleasure is their number one turn on. And so this was a big eye opener for me as a woman, having, I'm just having sex to keep my husband happy for the next few days, right? This is the checkbox for him. We had to turn around to say, no, that's the checkbox for me, because there's so much good that comes from that. With pleasure, there's oxytocin, and that's the most anti-aging hormone of our body. That is the most healing, regenerative hormone of our body. So the number one secret women need to know about men is that her turn on is his turn on. That's number one. And then number two, as I continued to dig in, I had a client who came to me as a couple, because I always like to treat, especially when I'm doing any hormone manipulation, what's going on in the relationship. Let me talk with you both as a couple, because if I'm working on healing one aspect from her, he's got to be on board as well. And so I had this beautiful couple that came to me, and he says, Dr. Anna, we have sex, but she has orgasm, she climaxes, but, she never wants to initiate sex. So I asked him, well, what do you do after sex? What do you do after her climax? What's your next step? Okay. Now, what do you think that would be? What do you think?
I know what I think it is.
What is it, Margaret? Tell me.
I would say he rolls over and goes to sleep.
Exactly what happens. And that's what he said. He goes, Dr. Anna, I roll over and go to sleep. Oxytocin effect on men is a sedative, and it makes them sleepy. So he's like, okay, check. I'm checked out. I'm done.
Yeah. Needs met.
Right. And for women, that oxytocin gives us that's that connection hormone. That's the time where intimacy is necessary to be nurtured during that time. Oxytocin is abundant just from play, and we want that connection, that intimacy. And if we're not getting the aftercare, that's I like to call it aftercare. if we're not getting the aftercare, I don't want to, I don't want to have sex
Right.
with you again. Basically, I'm not interested until, and I think that is a really big piece. So I said to him, I said, instead of rolling over and going to sleep, you just take a few minutes, connect, talk about what you love, what nourishes you, what you love about each other, what was fun, what you really enjoyed, what did she enjoy during that intimacy, focus on what you love about each other. And that can solidify. So that was basically, that's all I did for this couple at that first setting. And they came back for their follow-up visit. And he's like, Dr. Anna, she's initiating sex over 50% of the time now. Did I have to up her testosterone? No. Did I have to administer oxytocin? No. What did I have to do? I had to do nothing. He just had to have that time, that aftercare that nurtured her. That was the positive feedback for her to be more receptive and open to having sex, and therefore desiring more sex in and of itself. So, those are the two big secrets that I think it's profound that you share that with your clients. That goes a long way to increasing the oxytocin in their lives.
Now, we're talking a lot right now about, typical heterosexual couples. Do you notice differences in same-sex couples when it's two women? Is there any kind of special considerations for either individuals in that situation who have clients in that kind of situation? Anything there? I feel like we can make assumptions, but I never like to make assumptions that, because both partners are female, that they'll have the similar kind of needs and wants. But if I know humans, we're never that straightforward.
Right. That's so true. And working with same-sex couples that are women, one of the things is that need is for both of them. That need is to communicate, especially if there's a difference in role. One plays more of a masculine role versus the female role in the relationship. It's still that need for that connection time. That's what I've noticed in couples. So both have to focus on that, and that communication of what is bringing you pleasure. What is your turn on? What is bringing you this pleasure? What did you take from this togetherness that we've spent, this playtime? And for both of them, it is still that connection piece.
Love it. So let's talk physiology here for a second. So you said, vaginal health intimately connected with sexual health. Let's unpack that a little bit more. What are some of the things? I'm going to assume it's both vaginal health and hormonal health, impacting sexual health. So can you kind of walk us through some of the things that can impact both in a beneficial way and in a detrimental way?
Yeah, definitely. And I'm glad we're talking about this because, again, it's just not talked about enough. And what I want people to understand really is this part, that I say as a gynecologist, I'm a little biased, y'all. I'm a gynecologist, trained as a gynecologist, big advocate for women's health. And I can tell you as a gynecologist that I can tell a lot about a woman's health by looking at her vagina. You really can. You really can. It is a mirror to what is happening in your physiology. So whether it's gut health, and I always say, I can't fix your hormones without fixing your gut, right? Because you're not going to absorb them. You're not going to produce it. Is it stress? Is cortisol sucking, away the production of your own reproductive hormones? If you don't have DHEA, estrogen, testosterone on board, you're not going to have desire. You're not going to have healthy desire. Or is it the fact that you're having discomfort, vaginal infections, or with sex, because sperm is alkaline, you're going to have, potentially having odor after sex, having burning discomfort as we get older, and we have vaginal changes that cause like a decrease in estrogen, progesterone, testosterone, that cause thinning of the vaginal tissue and decrease in your own natural secretions, that you're having discomfort with sex or after sex with discharge, odor, bladder infections. And that's negative feedback. If you have pain every time you do something, why would you want to, right? If you know you're going to have odor after you have intercourse, why would you want to? And so I think that's an important piece that, again, we're not trained to talk about it as gynecologists, only talk about honeymoonitis. Have you guys heard of honeymoonitis?
No.
Honeymoonitis, like we could use that as a medical term, but it's when a woman comes like to see us, and she's had, new sex partner, or she's back from, a vacation and are on their honeymoon, and they've been having a lot of sex. And so it means a lot of semen in the vagina. And so she typically gets a bacterial vaginitis infection, the, fishy odor, and a bladder infection. So bacterial vaginosis and a bladder infection, we call that honeymoonitis. And so a real occurrence, but even more so as we get older and we have less of our natural vaginal acidity and defense mechanisms on board to keep the vagina healthy. But that's in healthy 20-year-olds, we'll see that, right? Yeah. And so this, honeymoonitis is a function of the alkaline semen and getting into the vagina, which is normally acidic, and that increases the bacterial overgrowth and can create that unpleasant fishy odor.
Right. Mm-hmm. Now, are you, so you're assessing people, obviously, as an OBGYN, you're looking at vaginas. None of us are looking at it. Right. So what are some of the clues, our practitioners, they're functional nutrition practitioners. So they're talking extensively gut health, diet, often also looking at hormone levels. And we will talk a little bit about certain things, that I think about, like, what are the questions in sort of a typical health history that kind of dip into this land of sexual health. And it would be about, like, how's your libido? And sometimes particularly if it's, female client getting older, we might ask about, vaginal health and pain during intercourse, but we don't go much further than that. Are there certain clues, certain questions we should be asking, certain clues that we should be sort of following up on those threads, and ways that we can assess these situations and support through the tools of, dietary intervention, really strategic supplement protocols, lifestyle pieces? What are some of the clues that we can be paying attention to?
Yeah. And I think that's such a good question, because you have access with time and a holistic approach that often their doctors aren't taking. Yeah. So it's so important to address this issue of sexual health. And you can say, how's your sexual intimacy now compared to what it was 10 years ago? And, how satisfied are you with it? Are you, and oftentimes say, oh, we're both equally good because he has erectile. I mean, I hear this all the time. He has erectile issues. So y'all get involved with his nutrition, right? He has erectile issues and, just not that interested anymore, but we're good. But what's happened is they become roommates instead of lovers. And that's where, that's a function of there's a problem. And I think as nutrition health experts and coaches, you're like, okay, you recognize that sexual health is necessary for optimal health. We want to address these issues, even though they're natural and the vagina naturally will change as we get older. It doesn't have to be that way. So let's look at what's creating this block, and would you like more orgasms in your life? Would you like to experience more pleasure? Do you understand how important this hormone oxytocin is? And one of the biggest ways we get that is through healthy sexual function. And again, I recognize, okay, believe me, your gynecologists probably aren't any more trained than you are. So let's go through this, and you guys ask questions, because I want to open up the conversation, how important this is for overall health. And so I think just by asking that, are you having, do you have bladder leakage when you cough or sneeze? Or after intercourse, do you have, infection, odor? How satisfied are you? How easy are your orgasms now? And do you understanding the most important way? If we've focused on your adrenals, we're working on filling that bucket, but the most powerful way to get you optimal health quicker is through oxytocin, is through your, having an orgasmic life, whatever that looks like, single or coupled, having an orgasmic life. And so then asking questions, because diet and nutrition and healing the gut, again, the vagina is an extension of the GI tract in a way. So you have to think about that, right? It has natural bacteria benefits from probiotics. It has its own microbiome. So gut health and vaginal health go hand in hand. Mm-hmm. And so you really want to make that connection through food, nutrition, supplementations, hormone therapy. Okay. When you're having changes here, we don't want them to persist in the vaginal area either, because that's going to lead to incontinence. That's going to lead to more dryness and prolapse and vaginal symptoms that when you have a vaginal yeast infection or any infection, you're like, oh, life is not good. Life is not good. So through diet and nutrition, we address that. And then the power of partnership and the power of orgasm and how critically important that is to get into ourselves and understanding, okay, I can't forget about below the waist anymore, right? I'm not going to forget about below the waist, because that's an important part of the quality of the rest of our lives, whether it's we want to avoid incontinence, whether we want to avoid prolapse, whether we want to have more amazing climaxes or orgasms, and to address that, in conversation. So tell me, what do you think are the, what are the stumbling blocks that keep you from asking those questions?
Yeah, that's a great question. So feel free to pop some of your questions in the chat if there are things that prevent you from asking those questions. I see one here from Mary Ruth. How do hysterectomies affect sexual experiences?
So it can be different based on the reason for the hysterectomy, but for many people post-hysterectomy, whether they've had their ovaries removed or not, there's been a disruption to the natural blood flow to the vaginal, vaginal blood supply. And so there's a hormonal shift that happens beyond estrogen, y'all. It is so beyond estrogen, right? There's so many hormones that affect our vagina, specifically DHEA, testosterone, progesterone. So beyond the hormone estrogen, the vaginal health is being affected. And recognizing that it's not because you're not interested. I mean, oftentimes you think, okay, well, I'm not as wet as I used to be. I'm not having the orgasms. I'm not getting or I'm not pleasing my partner or being pleased by my partner the way we used to be, or the way I would expect it. And that can, again, create that disconnect. And with hysterectomy, with that disruption in blood supply. Now, for some women who had pain with sex, and the reason was maybe adenomyosis of the uterus or painful fibroids or endometriosis, then sex can be more pleasurable. But it's attention to, the reason. I will say you have to have a directed attention. What was the reason for the hysterectomy in the first place? Because, the uterus is a bystander, is an innocent bystander to hormone imbalances and inflammation throughout the body. So you still have to address that issue and to improve overall sexual health.
100%. Anne says that I'm a retired midwife. Lots of my clients are still in touch with me, and several have mentioned they have trouble letting go in order to climax, not just getting excited. Any advice for this specific roadblock?
Oh my goodness. Yes, absolutely. And that to be able to be empowered to experience even some of the most mind-blowing orgasms of your life. And I say this with heart, because I went, for maybe 10 years of my married life without having an orgasm during sex. So number one, it's important to recognize that many women don't experience an orgasm during sex. And so how do you let go to be able to experience it? You have to become really present. And as I started to dig into this, I created this whole program called Sexual CPR, because there are many areas that are involved. But one is really being present. Actually, I always say there are the ABCs to sexual CPR. So if you want, I'll share those ABCs, because you guys know CPR, there's the ABCs, airway, breathing, circulation, to do cardiopulmonary. Well, with sexual CPR, there's ABCs too. And A is for women to be able to let go is to, number one, accept where you are right now, because your partner is focusing on what they like about you. And you're thinking, oh my gosh, well, I've gained this, I've gained this weight. If I lose 10 pounds, I'll feel sexier. And none of that is true. You have to, I would say, knock that nasty bitch off your shoulder who's talking that way to you. Is just, you can't allow that. Accept where you are right now and be present, be completely present in the moment. And this can be sensate focus, the practice of letting go, the practice of using your communication. And that's C, communicate what feels good, sounds, words, focusing on what you do like, and gently guiding them from what you don't like. And I say that because I had this client I'd been working with for a while and following through my sexual CPR program. And she goes, Dr. Anna, we're scheduling, inviting more, becoming more receptive. But yet every time he just sucks on my nipples and it hurts. My nipples are tender. And I said, what does he, how does he respond when you tell him that? She goes, oh, I've never told him that. He likes doing that. I'm like, okay, well, if you're like, you don't like that, then he doesn't, he's not going to want to do that for you either. So, there's mirror neurons, and, will feel that, but don't suffer because you think it's something he likes. There's so many other things that you like. And so communicating that with him, maybe not right in the moment, but because there's no other area in our lives that man or woman, no matter how successful, sexy, et cetera, you are, is that this is the most vulnerable area in our life, in our health, in our world. So sexual intimacy, we're really vulnerable. So positive words, are important, and positive, healthy communication is really important. So they, number one, know they're not doing something wrong, but you're saying, okay, I like it when you do this. This is tender for me. My nipples are tender and it doesn't feel good right now, but I will let you know when I feel like that would be a turn on for me. And I think that in of itself is kind communication. Plus, then you take that out of the picture, there's that negative feedback that's gone, right? Because pain, every time you do something, you're not going to want to do it. And then you have more interest and receptiveness in having that time for intimacy. So ABC, accept where you are now, be present, and communicate what you like, and gently what you don't like. And I think that's, and what you want, right? What you want from the experience, from what you want from each other. And for women, especially, again, to recognize that it is for your pleasure. It is, for your pleasure that you're agreeing to intimacy to begin with.
Such important points. I have a follow-up question, and I also have an observation and a tip for anybody who gets like crazy monkey mind, because I get crazy monkey mind. This definitely affects sex, but also affects sleep and all sorts of things. So when you say that, be present, one of the strategies I have found, because if I don't do something very proactive to release whatever it is that's keeping me really preoccupied and a little stressed, then that's just with me. Right. Like I'm in the act, but my brain is literally like doing to-do lists and like strategizing. It's not, he knows, and it's not good for anyone. Right. And I'm certainly not getting the benefit of the whole situation. And so one of the things that I found is if I can like really proactively, whatever is on my mind, I proactively delegate it to God, to the universe, whatever your beliefs are. But I will literally, sometimes I have to even write it down, say like, okay, here's the list of things that are going through my mind right now. I can't pay attention to it right now because I have to have sex, or not have to, I get to have sex. I need to sleep, whatever it is. But then just sort of assigning it to sort of another entity to be working on, so that it doesn't feel like I need to be holding it, has been really effective for me to let go and to then be present. And without that, sometimes there's just no way.
I love that, Margaret. That is so good. That's so true. Good way.
My follow-up question is about the communication. So for those who either here or talking with their clients who are feeling either shy or, as you say, I mean, this is one of the most vulnerable things that we can ever do, even if it's somebody we've been with for years and years and that we are the closest to. Sometimes that can make it even more vulnerable, especially if we've been maybe, I know I have friends who have faked it for years with their spouse, and now to actually reveal that is a moment, right, in their relationship. And so what would be your advice for somebody who's feeling really reluctant to open that door and to even begin the conversation? Like, should they have it at the time, at a separate time? What are some parameters that can make it a little safer?
Definitely at a separate time. Right.
Yeah.
Because during the act, that may be a reminder, okay, we're going to have this conversation, but after, then stay really present, guide him. I want you to do this, or touch me here. This really turns me on. I like it when you go lighter and harder, but it can be all of the above. It's never just one way, but at this moment, right? So really focusing on what's happening at the moment that's bringing you pleasure or that you think will bring you pleasure. Don't expect him to read your mind. Communicate it, talk about it, give him that verbal feedback and physical feedback so they know, so the partner knows. So they're not just figuring, that you always liked it this way. Say, well, I did enjoy that, but now I'm uncomfortable or I prefer this. So I think it's outside the bedroom that you're able to talk about that, because again, it can shut people down. Yeah. Goes both ways. And so I think that's an important piece. And then back to the monkey mind, totally get it. Man, I've done to-do lists, carpools, shopping lists. I mean, I've done it all, right? And during the time of intimacy, and totally checked out of the physical experience. Okay, God, just let him be done. And when he's done, we're happy he'll roll over and go to sleep. I mean, that is not how I coach or how I am now. And I think a piece of that too is that communication, gosh, it's been a stressful time. If you find me checking out, if you feel like I'm checking, spank me and get me back into it. I mean, do something to put you back in your body, right? To put you in a fun way, put you back in your body, and you can communicate that in a fun way. Like, oh my gosh, totally. And then again, asking for what you want, being playful and fun, and saying, let's try something new, or help me with this, because I totally want this to be the glue that keeps our marriage healthy together, keeps our relationship healthy and together for the long haul. So I think being able to say that outside the bedroom, it's critical. And then during play is to look at it as play. Yeah. I guess, what gives you fun? What do you enjoy? Where are all the places you haven't explored yet that you'd like to touch, and play with that too. And sometimes it's, it is just bringing in that attention, and also exploring your limitless sexual potential that each of us really have, so you can have better mind-blowing orgasms and energetic orgasms that are whole body, and how you can bring yourself to that and explore with that potential, that limitless potential that your body has.
That's wonderful. Great advice. Kelly has a question. What to say to a client with a bladder leakage when laughing or coughing? Does this usually happen in one's 40s and beyond? And do you recommend one of those vaginal lights?
Very good question. So one of the things that I always do if we are having bladder leakage, and it can be from loss of muscle tone, from childbirth. It can be from natural hormonal changes as we're aging, just like we'll get loose muscles, on our underarms or around our face and neck, right? That happens to our vaginal area. Again, that's why our vaginal health is so important to optimal health, because when you have bladder leaking, you're going to do less of those things, less laughing, less jogging, less running, less playing, less sex, especially if you're worried about having a bladder leak or accident during sex. And so this is where, as a gynecologist, I recognized how critical bladder health was, and vaginal health and bladder health was. And I started using using vaginal hormones and working to improve the health of the vaginal tissue before I did a bladder procedure or an operation like a bladder sling or incontinence procedure to tighten up the urethra so you're not having these leaks. And as I used vaginal hormones over and over again, preoperatively, giving it more time, using stronger doses, I found that when my patients came back in for their pre-op for surgery, they no longer had the bladder leaking. And so, that's one of the reasons I created my product Julva, to have an over-the-counter option when clients didn't have a physician comfortable with prescribing vaginal testosterone and DHEA. So it created Julva, but that can make a difference with always pelvic floor exercises done right. Attention to the pelvic floor, doing, pelvic floor exercises, Kegel exercises, keeping the vagina healthy, avoiding stimulants to the bladder like caffeine and sugar that can cause bladder irritation as well as incontinence symptoms that are a real big problem. So pelvic floor exercises, vaginal hormones are game-changing. Vulvar hormones are game-changing when it comes to bladder health, and that also better bladder health, better sexual health. So even a roundabout way into coming back to this conversation as nutrition and health coaches, it is talking about incontinence. And if you're having bladder leaks, if you're having urgency symptoms, most likely there are sexual health problems too.
Right. I see the next question is about coconut oil. I want to talk about that in a second, but we just mentioned a little bit more about Julva. Can you just tell us a little bit more about it? It is a phenomenal product.
Thank you. So I created Julva when I closed my medical practice, and my clients were like, Dr. Anna, no one will write us your compounded creams anymore. And I've committed to creating something that was available without a prescription that worked even better than anything I could prescribe. And that was cleaner without hormone disruptors. And so that's where Julva. So you think of vulva and think of Julva, like vulva with a J, Julva. And it is a combination of DHEA and plant stem cells from the alpine rose in a special formulation with coconut oil, emu oil, shea butter, and to really penetrate that tissue. And we see that complete natural restoration of the folds and the moisture and your own natural moisture. So it's so much better than using a lubricant because your body's producing its natural moisture again. And I mean, it really does make a big difference. And again, clean without the hormone disruptors. Most of the times, women are given a prescription for estrogen vaginal. Yeah. And we're not even addressing the clitoris. I mean, the clitoris has 8,000 nerve endings, and that's going to atrophy and get smaller as we age, unless we're doing something about it. Right. So, and the other thing that I want to bring up on the clitoris, because I always think that is, the unspoken hero of the female body, but the clitoris is amazing and, for pleasure, but sometimes it's traumatized from heavy vibrator use. Now it's fun to do that, but it can traumatize those nerve endings and dull your sensation. And so taking a break from the vibrator, using a product like Julva, using softest, gentlest touch as part of play. And again, becoming really aware and present and focused on that touch, sensate focus essentially on the lightest touch, that can reawaken that beautiful nerve, those nerve endings and sensation to bring you to, again, even greater orgasm. It can take a while, and it can, as sometimes women will say when they've start to reawaken those nerve endings, it can feel like pins and needles or ground glass type of feel. As they're reawakening. That's just how much damage we can do to the pelvic floor from vibrators. So,
oh wow, that's really good to know. And when do you recommend that women start to use Julva? Like, I'm assuming you don't wait until there's a problem, right? Like don't wait till there's a proactive. Problem.
Yeah, just like you start looking at your wrinkles here. down there, it's even more important, right?
Yeah.
Like we'll take our laugh lines and smile lines, right? But down there, I will not take any lines, right? And I think I was traveling a lot this summer, and I take Jolva with me. Then I give it away, or whatever it may be. And so there was a time period, probably a good 2 to 3 weeks, that I was without my own Jolva. And, I've delivered 4 big babies. I had incontinence issues and all these things that have disappeared without surgery. And I started to not make it to the bathroom in time and think, oh my gosh, I had stopped using it. So I say in our 40s, we should definitely start using a product like Jolva, because our DHEA starts declining in our 20s. And if we have any clitoral atrophy, and if we have any vaginal dryness symptoms, or we feel like we need more lubrication, use Jolva. You can use it during sex. It's fine for guys. They can take 10 times the amount of Jolva and still be fine, And so start in your 40s, and it's never too late. I have clients in their 70s who started using Jolva and turned around incontinence issues, prolapse symptoms. I mean, it blows my mind. And certainly, to have healthy vaginal moisture again of their own. That's empowering.
A big deal. That's a really big deal. Would you recommend they use it just once a day, twice a day? And I'm seeing some questions here about it. I want to make sure we answer these. Is it safe after hormone positive breast cancer?
That's a good question. Yeah. This is my Jolva 30-day tube. It has an applicator on it, because I have this with my lip formula also for the upper lips, to put that on there. And it's more of a gel formula because I was telling my clients, and I was using it myself for little lip lines that I was getting. And they're like, oh, I can't use that for that. And I was like, yes, you can. And then so I finally gave in and I made a lip formula. Jolva is, it really is, again, all natural ingredients. It is a little bit goes a long way. I recommend using it in the morning, after your shower, whatever, just apply it. A clitoris to anus, keep that tissue. How many of your clients struggle with constipation, anal fissures, especially during a cleanse? They get irritated from, flushing too much, from maybe some watery stools, can be very, very painful. Let them, and also after sex as aftercare, you can use Jolva, actually this formula or the lip formula. It's good. But so it is perfect to use every day. Sometimes we have to bump up and use it twice a day initially. And then sometimes after a while, you can go down to using it 3 to 5 times a week just for maintenance.
Yeah. It's a great product, y'all. If you haven't tried it, definitely I see that there's several people in here who have tried it. Now, would you recommend? So Laura had the question of coconut oil as a lubricant. So I want to have you answer that question. Does coconut oil as a lubricant affect the vaginal microbiome? And just can you use Jolva, or is that I'm assuming that what you would see happen is that if somebody was experiencing vaginal dryness and they'd been using Jolva successfully, they're starting to produce, as you say, their own fluids again and not necessarily needing the lubricant.
Yeah, definitely. And I see that so often, are using some Jolva during sex. Now, coconut oil for that, and I want to come back to the breast cancer question, but coconut oil, again, depends on how much you're using it. I love it as a lubricant, as a moisturizer, and, definitely to create that protective barrier. And I make a do-it-yourself lubricant. I have a video on my YouTube channel at The Girlfriend Doctor on this. It's got hundreds of thousands of views, but it's your do-it-yourself lubricant, and it's with equal parts of fractionated MCT oil, so it's liquid at room temperature, and aloe vera, and a clean organic aloe vera gel. And so combine those two, and you can add a drop or two of your favorite essential oil that turns you on. I love bergamot and rose. I think those are two of my favorites. And you apply that, because the aloe vera is very healing to the vaginal tissue, and you're diluting the amount of coconut oil you're putting in, but still creating that nice that nice sensation, that nice slickness that lasts. And again, you're okay. Depends on how much you're using coconut oil. There is a little in Julva, but we found an improvement in vaginal pH and in, our body's own natural vaginal moisture with the combination. And in my clients, and one of the reasons I created Julva and why I was a referral doc I had clients who came to me from around the world, especially if they'd had breast cancer, was because I want to always address the underlying reason for the cancer, right? The underlying reason to begin with. It's typically not our own body's estrogen, right? It's not our own body's estrogen. It's hormone disruptors, it's inflammation. It's, there's a number of things, but definitely endocrine disruptors and inflammation are two of the biggest. So I want to address those issues, improve their insulin sensitivity. And if I can get them to have more sex and more pleasure, they're going to have, a better life. And what the research has shown, even with vaginal estrogen, is that vaginal estrogen did not increase the risk of breast cancer. And again, one of the reasons I created Julva was for my patients who'd had breast cancer. What could I do for them naturally? I could use DHEA, I could use testosterone. And as long as I'm watching where it's going, you guys are checking your hormones, or if you're using a Dutch test and looking at estrogen detoxification profiles, how well is their body eliminating and detoxifying estrogens and other hormones? And are we creating more of the other head to toe approach, insulin sensitivity, lower markers of inflammation, improved hormone balance? Then we're doing overall a really good thing. And the research with DHEA and breast cancer, and I have some of that published on my website as well, my white paper on DHEA for vaginal dryness. It's very safe in women who have had breast cancer. Now, if she's currently undergoing treatment with tamoxifen, I would just wait. I would just wait, or get, definitely you have to get approval from their oncologist. I do have many oncologists that do recommend Julva as well, and vaginal hormones. And again, because the quality of life, once they start seeing what a difference it makes in their patient's quality of life and their overall health, it is something they start to recommend regularly. So I think that's important, but each person is individual. And so looking at that for sure.
So great.
I feel very safe with, again, when I'm working with patients, I'm following my keto green way. We're dropping their hemoglobin A1C, dropping their HSCRP. We're improving their DHEAS. We're improving their vitamin D. I've reduced their risk of breast cancer just by that. And now add in, pleasure and oxytocin, and decrease the symptoms of vaginal dryness, bleeding. Terrible. I have a 42-year-old client who had stage 1 breast cancer, and she had married 2 years prior. And she said every time they have intercourse, she bleeds. And she's like, it hurts. And I hear that over and over again. She shouldn't be suffering like that. No. That is unfair. That is unfair. And yeah.
Looking at the time, I could talk to you for hours. There's so many great questions here. There's so much. I want to make sure people know how to connect with you, how to get access to your products, how to get access to the sexual CPR. I have 2 last questions before we go into that. One is, do you have a recommendation that you think, number of time, we're talking about Julva, how much you should use it. How many orgasms should somebody be having in a week? Is there, when we're thinking about oxytocin, and do you measure oxytocin in your patients, or when you were seeing patients in person, were you measuring oxytocin?
It's really hard.
It is hard, isn't it?
It's really hard to measure oxytocin. And to date, I don't think there's a better way than doing a fresh frozen test. And there's only a couple labs in the country, to my knowledge, that are doing the oxytocin testing. It's so volatile. It really is. And so it's hard, but I do a quiz, and it's like, just think of, you can get an idea when you shake someone's hand and their hand is cold and clammy, or think of an Asperger's or autism client. Those are oxytocin deficient individuals, right? And there may be something, like you guys are taking obstetric histories and what happened during childbirth. Note, if that person was given high dose oxytocin during childbirth, had a C-section, and not a vaginal birth, those are red flags to me that there's an oxytocin deficiency. I think we're finding there may be a correlation between it being administered high dose oxytocin. The other thing is adverse childhood experiences. When you have clients that don't have that initial bonding, or that say like that oxytocin increase and, in childhood, they may have, fewer oxytocin receptors or not sure, decrease in ability. But think of this in my autism or spectrum patients. They are pale. They won't look at you in your eyes. So let me give you an example. I've used oxytocin. You can prescribe it for sexual health. I prescribe it for burnout, but don't prescribe it like if you're not prescribing it too long, because you're going to decrease your body's natural production. We never want to do that. But I had a client I was treating with her oxytocin for optimal health and sexual health. And she gave one, she's like, for whatever reason, she gave it to her 20-year-old son who was just sitting on the couch, not doing anything, not motivated. And she's like, here, take this lozenge. And she gave it to him. And she goes, it changed him. So I want you to evaluate him. I'm like, okay. So I brought him in. I gave him my oxytocin questionnaire, and I was looking at him, shook his hand, cold and clammy, face pale, not making eye contact with me. And so one way I would test would be an injection of oxytocin, 10 units intramuscular. And so again, the quiz itself told me his physical examination, pale, clammy, not making eye contact, told me. But then I gave him the injection. He immediately pinked up, right? You get the orgasmic flush. His ears were pink as can be, right? And he starts smiling, looking at me in my eyes. And then we had a conversation.
Wow.
That showed his oxytocin insufficiency. So you can say, after laughter, how do you feel? And, after orgasm, how do you feel? And, how does that really relate? I mean, in general, we're going to feel better, more flushed, more receptive, more connected. And that is game changing for people and for couples. And so it's hard to do, but I have I do have an oxytocin quiz on my website. I got to fix the funnel on that, but you can see some of the questions that I ask and get an idea of what you can ask too. Because if we're oxytocin deficient, I mean, that's really big. We're missing a lot, and trauma will do that to us. Just physiology. It could be a physiologic defect, but again, you can regain that. So I prescribed this young man, this 20-year-old who was on the couch, not doing anything with his life, some lozenges of oxytocin. And I started at 20 international units, sublingual or between the cheek and gum. And has, reported back to me within 3 months. I mean, seriously, within 3 months, he'd gotten a job, gotten a girlfriend, was, motivated and taking college courses. I mean, within 3 months, that blew my mind. I had no idea it would have that effect. And so, oxytocin is important for physical health. It's important for mental health. It's important for social connection. And it is deficient when we're high stress, high cortisol, when we're on spectrum, when we're, had trauma. And so, it just changes your life.
It's incredible. It's incredible. Yeah. Okay. I think we might have to do a part 2, because there's so much. Now I just have so many more questions for you, but how can people, no, I have, I am going to save my questions because it's just Pandora's box. I can just keep going. Tell us where are the best places for folks to connect with you? We're going to send, you've got multiple resources. Can you kind of walk us through the resources with that sort of practitioner lens? So thinking about both of the, audience here for themselves, but also for their clients.
Yeah. So step 1 is my book, The Hormone Fix. It is my magnus opus. And that is, comprehensive, my approach to helping with hormonal balance. It's not just for the menopausal woman, but I certainly do target the most difficult age range that we have, right? And so, The Hormone Fix is a starting point. And my website, certainly, I've got tons of free resources and quizzes and programs, my Magic Menopause program, but most specifically, and I think my heart is really into my sexual CPR program, because it is a very holistic approach to see what are the multiple ways that are keeping us from being connected. That are keeping us from being connected. And I think that that's a really important program, and you can sign up as an affiliate for health practitioners at dranna.com/affiliate. And all my products have affiliate links so that you can wholesale products in your practice. We have wholesale accounts. We also have online affiliate accounts where you get a link. And for like sexual CPR, you get 50%. For Julva, you get 25%. And we fulfill all of that. So I think it's just one of those like cornerstones of quality health and good health. And I'm always happy to talk about it, to answer questions. Please connect with me. So I'm at The Girlfriend Doctor on Instagram. Be sure to follow me there, and also at my website, dranna.com.
This has been so great. I'm seeing comments here. Everyone wants you back for a second time. So we're going to need to make that happen in 2023. This is so excellent. Thank you so much for your help. And, guys, go out and try Julva if you don't have it. If you have it and you have been scared to try it, now you know not to be, and go give it a try. We didn't even talk about menopause. My gosh, there's so many things. You're just doing so much great work. We can't keep up. Thank you so much.
Thank you. I know I wish I could get to all your questions here. Maybe send me the chat and I'll look at things to see if I can't send you some quick answers too, or do a quick video follow-up for you.
Oh, that would be so wonderful. We will totally do that. Thank you so much.
My pleasure.
Thank you, everybody.
Thank you, everyone.
Have a wonderful evening. Take care.
Bye, everyone.